A rare strain of enterovirus, a lower respiratory infection, has led to a sharp spike in the number of children being hospitalized for severe breathing problems in several states. There are no reported deaths or confirmed cases in California, but the Centers for Disease Control and Prevention issued a warning for local healthcare providers to be on alert for Enterovirus 68. Here with the details is my guest, Dr. John Bradley, Division Chief of Infectious Disease at Rady Children's Hospital, and welcome.
Thank you so much.
Now, Dr. Bradley, this Enterovirus 68, what is it and what are the symptoms?
Enterovirus 68 is a fairly new name for a virus that looks very much the same as the one that causes the common cold, or rhinovirus. So our ability to sequence the viruses allows us to give them new names. So what this is a common cold virus with a nice, sophisticated name, but it's one that causes chest colds that are a bit more severe than the standard common cold with a chest cold. So for children with underlying asthma, where when they get a chest cold, the asthma gets worse, this particular virus causes more inflammation, and those kids who already have underlying sensitive airways get into more trouble with asthma.
How is this infection spread? Is it spread like a cold, and how long would it typically last?
It's spread exactly like a cold. It is a cold, basically, with a fancy name. And it's spread just like every other cold. Your nasal secretions are contagious, throat secretions. If you sneeze on someone, they're going to get it. The range is about 3, 4, 5 feet. So if you're 6 feet away from someone, you should be protected.
And you mentioned this affects, we're looking at video here of the bronchi and the bronchial. You mentioned that this affects kids with asthma. How come?
Each of the cold viruses has a different ability to attach to the upper airway, the nose and throat, and the lower airway. So some viruses just give you a runny nose, and everyone knows other viruses, it may start out there, and then you start to cough, and you have a lot of mucus and bronchial irritation. So this particular virus tends to have a tropism, or tends to be able to stick to lower respiratory tract, lung tissue, better than most cold viruses. That
we just saw, sort of that bronchial area.
Yep.
How is it treated?
Symptomatically. You keep hydrated so that the mucus is nice and moist and you can cough things out. If you've got fever, which a lot of these kids have, you just take standard Tylenol and ibuprofen. There are investigational drugs for enterovirus, and actually one of the other strains causes severe disease in newborn infants. And at Rady Children's Hospital, we actually did investigational clinical trials with some of these agents. None of them are approved by the FDA right now, but in someone who's really, really sick, it's possible to get a hold of some of these.
But it's important for parents to know it's a virus, so antibiotics aren't going to treat it.
Absolutely.
These kids that we're seeing in the hospital, a lot of them asthma patients, they get inhalers as well, or oxygen, or what do they get?
Both, and intravenous medicine.
I see.
So for most of the parents, especially those of kids with asthma, when they get a cold, the kids start using their inhalers more. So what's different about this virus is that the few puffs that used to work for the regular chest cold don't seem to work for this. The inflammation and the spasm is much greater, and so if it doesn't work, they need to go back to their healthcare practitioner or the emergency department and get stronger stuff to open the airway.
I see. Now, there have been no confirmed cases of the virus in California, and doctors are not required to report this to the public health agencies, but Rady Children's is actually being very proactive in this. What are you doing?
All of the kids that come into the hospital now with more serious disease, we're getting samples from the nasopharynx, the deep part of the back of your nose where it joins the throat. And we're collaborating with the county health department. They've been wonderful. Dr. Eric McDonald has gotten our samples, sent them up to the state where they're being tested for Enterovirus 68. And actually, for the first batch that we sent up, we hope to get results just within the next day or two.
All right. Well, we are out of time. So, Doctor, thank you very much for talking with us.
Thanks so much, Peggy.